You're brushing your teeth tonight. You glance in the mirror, and for a split second, something feels off. Not pain, not illness, just a whisper. What if your body has been trying to warn you for months, and you've been missing it? Here's the unsettling truth. Diabetes doesn't always knock loudly. Sometimes it tiptoes in, changing small things you can actually see, long before a diagnosis is made. And by the time most people notice, damage may already be underway. But today, we're flipping that script. I am Dr. Michael, and by the end of this video, you'll know exactly what to look for. The subtle, visible clues, so you can act early, protect your body, and stay in control. Let's break it down. Most people think diabetes shows up dramatically. Intense symptoms, obvious warning signs, something impossible to ignore. But in reality, it often starts quietly. Diabetes is a problem with how your body handles sugar. Normally, insulin acts like a key, unlocking your cells so sugar can enter and be used for energy. But when that system breaks down, sugar begins to build up in your bloodstream, and here's where it gets dangerous. That excess sugar doesn't just sit there, it starts to stick to proteins, to blood vessels, to nerves, slowly interfering with how your body functions. It's a process called glycosylation, and it's happening silently. This is where people feel blindsided. I felt fine. How did this happen? It means your body could be signaling you, right now, in ways you haven't connected yet. So let's walk through the signs. And I want you to stay with me, because number 4 catches a lot of people off guard. Number 10. You're waking up at night, more than usual, to urinate. Now this might seem harmless. Maybe you drank water late. Maybe it's just a phase. But here's what's happening inside. When blood sugar rises too high, your kidneys try to flush out the excess glucose, and sugar pulls water with it, like a magnet, so your body starts dumping fluid over and over again. That's dehydration in motion. It disrupts sleep, leaving you drained, foggy, irritable. Day to day, you're waking up exhausted and reaching for more sugar or caffeine, which quietly feeds the cycle. Number 9. Constant thirst. And I don't mean I could use a drink. I mean that dry, persistent feeling, like your body just can't catch up. This ties directly to that fluid loss. Your brain is sounding the alarm. We're low on water. But here's the trap. If you're hydrating with sugary drinks, juice, soda, you're unknowingly pouring fuel on the fire. Number 8. Dark, velvety patches on your skin, especially around the neck, armpits, or groin. This is one of the most visible signs, and one of the most ignored. It's called acanthosis nigricans. Inside your body, high insulin levels are overstimulating skin cells, causing them to grow thicker and darker. It's not dirt, it's not poor hygiene, it's your body signaling insulin resistance. Emotionally, people often feel embarrassed, scrubbing harder, hiding it. But recognizing it, that's power. Number 7. Skin tags. Small, soft growths, usually where skin rubs together. Individually, they're harmless. But when multiple appear, especially in the same areas, it can be another clue pointing toward insulin resistance. Think of them as tiny flags, your body planting quietly. Now, before we go further, quick pause. If this is opening your eyes even a little, if you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about, because the right information can change someone's life. Because honestly, it really can. Let's keep going. Number 6. Frequent infections. Skin infections, yeast infections, urinary tract infections. Here's why. Sugar feeds bacteria and fungi, literally. And at the same time, high blood sugar weakens your immune defenses. So your body becomes a more welcoming environment and a less effective fighter. Practically, this shows up as infections that keep coming back or take longer to heal. Number 5. Stiff hands. Try this with me. Press your palms together, like you're praying. If your fingers don't fully straighten, or your palms don't completely touch, that could be something called the prayer sign. Inside your body, excess sugar is binding to proteins in your tendons, making them thicker and less flexible. It's like your joints are slowly losing their glide. Some people mistake this for aging, or arthritis, but sometimes it's something deeper. Number 4, trigger finger, a finger that locks, then suddenly snaps straight. It can feel mechanical, almost like something catching. That's because it is. The tendon that moves your finger becomes inflamed and stiff, again due to glycosylation. So instead of gliding smoothly, it sticks, then releases. Mini clue. Big meaning. Number 3. Numbness or tingling in your hands and feet. At first, it might feel like pins and needles, easy to ignore. But here's the reality. High blood sugar damages the tiny blood vessels that feed your nerves, and the nerves themselves. Over time, sensation fades. And this is where things can get serious. Because when you can't feel your feet properly, you don't notice injuries. A small cut becomes an ulcer becomes infected. And without intervention, this is how people lose limbs, not overnight, but step by step, unnoticed. Number 2. Slow healing wounds, cuts that linger, scrapes that don't close. Your body's repair system depends on good blood flow and strong immune function. Diabetes compromises both, so healing slows down, sometimes dramatically. And number 1, digestive issues, like bloating, nausea, or feeling full quickly. This is something many people never connect to blood sugar, but diabetes can damage the nerves that control your stomach. So food just sits there longer. Digestion slows. Blood sugar becomes unpredictable, and everyday life becomes uncomfortable, even frustrating. Now let's bring this together. How do you actually confirm what's going on? There's a test called HbA1c. It measures how much sugar has been attaching to your red blood cells over the past 2 to 3 months. Not just a snapshot, but a pattern. A result of 6.5% or higher suggests diabetes. And this matters because catching it early changes everything. So what can you do starting today? Think simple. Think sustainable. Focus on fiber-rich foods, vegetables, whole grains, things that slow sugar absorption. Reduce added sugars and ultra-processed foods. Move your body consistently. Walking, strength training, both matter because exercise makes your cells more responsive to insulin. And if you smoke, this is your moment to quit. No perfect time will come. These aren't extreme changes. They're small shifts, repeated daily. And here's the part I want you to hold on to. Diabetes is not a life sentence of decline. It's a condition that can be managed, slowed, even prevented when caught early. Your body is not working against you. It's communicating. Every sign we talked about today is a message, not to scare you, but to guide you. So if something you heard today feels familiar, don't ignore it. Get tested, ask questions, take that first step. Because small actions, taken early, can protect your freedom, your confidence, your quality of life. And that matters. Stay curious, stay aware, stay in control. I'll see you in the next one.